Good evening, everyone. My name is Angela Hutchins. I'm here tonight to speak to you on behalf of In It Together for Diabetes. In It Together for Diabetes is a program created to provide educational materials for people with diabetes as well as their families. Another goal of In It Together for Diabetes is to provide a community forum whereby patients and their families can come together, share their own experiences and knowledge, keep up to date on the new developments dealing with diabetes and its treatment, and generally support each other through the difficulties that can develop from this disease. Diabetes is an increasing threat throughout the world, and it is predicted by the World Health Organization that by the year 2030, diabetes will be the seventh leading cause of death throughout the world. There has also been an increased amount of people being diagnosed with diabetes throughout the world, primarily amongst low-income and middle-income developing countries. What is diabetes? Diabetes is a series of autoimmune diseases that affect the body's ability to use glucose, or blood sugar. This leads to an increased level of this in the body, and is often caused by a failure of the body to produce enough insulin, or a failure of the body to use the insulin that is produced in an adequate manner. Glucose is a vital source of energy for many of the processes throughout the body, and a failure of the body to break it down efficiently can lead to many complications. The first type of diabetes I'm going to speak of is type 1 diabetes, also known as juvenile diabetes. This often occurs from a complete shutdown of the body in producing insulin, and it is triggered by a disease that forces the body to attack its own insulin-producing cells. 15% of all people diagnosed with diabetes have this type. Diabetes, left unchecked, can lead to many different complications. Even when it is treated, if there is a failure to treat it properly, these complications can occur. Such complications consist of kidney disease, nerve damage, blindness, an increased risk of Alzheimer's disease, osteoporosis, and cardiovascular disease. There are many other complications that can develop from this disease, and these are only a few. Type 1 diabetes requires regular insulin productions in order to maintain a healthy lifestyle. However, a diet low in fat and salt and consisting of little to no added sugar, as well as high in complex carbohydrates and with a variety of fruits and vegetables and whole grains, can assist with managing this disease. The next type is type 2 diabetes. This has previously been referred to as adult onset diabetes, as it was typically diagnosed in patients ages 35 and older, and there is an increased chance of developing this disease as a person ages. Unfortunately, cases of type 2 diabetes have increasingly been diagnosed in teenagers throughout the world. Type 2 diabetes is an insulin resistance. This is where the body cannot sufficiently use the insulin that is provided to it. And the risk factors of this disease consist of obesity, a sedentary lifestyle, and poor eating habits. Management of type 2 diabetes in the beginning often does not require insulin injections and can be managed through many different prescription drugs. However, as time goes by, this disease can eventually lead to a need for insulin injections. Not always, but often. The third type is gestational diabetes. Gestational diabetes is typically diagnosed in women and is diagnosed amongst pregnant women who previously have had no history of diabetes. 18% of pregnancies result in a diagnosis of gestational diabetes. Gestational diabetes is often accompanied by increased levels of blood sugar in the body. And while the insulin itself does not pass directly to the developing fetus, the increased levels of blood sugar can lead to a heightened birth weight amongst infants, which can lead to many complications during the birthing process. In addition, children of women who have been diagnosed with gestational diabetes tend to have a greater chance of developing obesity and type 2 diabetes later in life. Women who have been diagnosed with gestational diabetes need to keep in mind that in future pregnancies, there is a greater chance of being diagnosed again with gestational diabetes, even though it is considered temporary. Another problem with gestational diabetes is women who have it seem to have a greater risk of developing type 2 diabetes later in life. As mentioned, gestational diabetes, like type 1 diabetes, requires steady insulin injections and careful blood sugar monitoring. However, other ways that it can be managed deal with special meal plans and increased activity in addition to monitoring of blood sugar and the insulin injections. The symptoms of diabetes are many, but some of the main ones are increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, high blood pressure, blurred vision, slow healing sores, and frequent infection. Diabetes can often be detected through simple urine tests that detect an increased amount of ketones in the urine, which is a type of protein that builds up during diabetes and can lead to many complications as it creates an acidic environment in the blood. It is vital that if you have any of these symptoms, you speak directly to your medical practitioner. Any information provided by In It Together for Diabetes is no substitute for what your doctor and medical practitioners can give you. Please, get it checked out, because the sooner you can recognize your symptoms, be tested and diagnosed for diabetes, the sooner you can begin treatment. And with all the amazing advances that are made in medical technology dealing with the disease, the sooner you begin your treatment, the greater your chances are of lessening the complications and living a happy and healthy life with this disease. Thank you.